1,200 years ago, the people of Tibet developed a comprehensive medical system. They understood how the mind can powerfully affect the body. They knew subtle ways of changing the body's chemistry with medicines made from plants and minerals. They blessed their medicines and their patients in lengthy rituals. And they encoded this knowledge in a series of elaborate paintings. Today, Tibetan medicine is the focus of a worldwide interest in traditional medical knowledge. One of the conceits of present-day society is the notion that modern science, technology, and medicine have made the past irrelevant. But long before there was even science or medicine, people were observant and inventive as they developed ways to combat sickness, both physically and psychically. India and China have traditional practices that have roots in antiquity, and we're gaining insights into traditional medicine from the near mythical kingdom of Tibet, steeped in Buddhism, that could be invaluable in industrialized countries as well. In Lhasa, Tibet, the birthplace of Tibetan medicine, much of Buddhist heritage has been dismantled or destroyed. Buddhism's ancient synthesis of priest and healer doesn't always coexist easily with communist ideology, but many Buddhists have hung on to their traditional beliefs. When the Buddha left his sheltered life, it was the shock of seeing someone who was sick, someone old, and then someone who had died that set him on the path to enlightenment. The Buddha himself claimed to be a healer, not a god, and offered his teachings as remedies, not gospels. Known as Sangye Menla, he is the medicine Buddha, the master of remedies, the healing deity of Tibetan medicine. His radiant body is azure blue, the color of healing. In his hands, he holds a bowl filled with the nectar of long life and the flower of healing. Guided by centuries of practical science, Tibetan doctors are taught that there is nothing in the world that cannot be used in some form as a medicine, and their traditional knowledge includes turning a vast number of minerals and plants into medicinal compounds. Practitioners still use treatments that used to be part of Western medical practice, but have now been changed or abandoned. The ancient wisdom of Tibetan medicine resides in this stunning visual encyclopedia of the human body and psyche. Based on centuries of observation, these intricate paintings represent a blend of Buddhist spiritual teachings, a complex medical science, and an elegant art form. These paintings were made with a remarkable insight into how the human brain absorbs knowledge. They're a visual record, created to pass along a vast amount of information in logical groupings. This tree branches off to display the three basic methods of diagnosis. First, observation. The leaves show the doctor how to look carefully at the patient's body, particularly the tongue and urine. The center branch shows the importance of touch and accurately taking the pulse. The last branch illustrates how the doctor should question the patient, asking in detail about symptoms, past illnesses, daily habits, moods, diet, and any areas of pain.